My name is Blessing, and in this video, I'll be showing you an Airtable system I built for an ENT journey tracker practice. It manages everything from patient record to consultation, surgery, task, referrals, and finance reports, all connected and automated in one place. I also set up role-based forms for doctors, nurses, admins, and patients, and each of these forms includes conditional logic and link to existing records. I also created automations to help reduce manual work. So these are the tables I created. We have the patient consultation, surgeries, task, referrals, finance reports, patient feedback, and patient follow-up. So for the patient table, this patient table includes all details of the patient, of each patient, as we can see here. These are the details of the patient with the attachments or documents included. These are the various fields I created for this project. Now, for this, we have the linked, we have the linked fields, which is linked to the different tables we have here. As you can see here, we have the surgeries, task, consultation ID, referrals, finance reports, patient feedback, and patient follow-up. Now, I created a field which is called the feedback form link. So this link is a personalized link that carries the name of each patient to get their feedback. So once the link is sent to a patient, they go ahead and fill the rest of the details in the form without having to include their name again. So this is the link right here. As we can see here, it came with the patient's name, which is personalized. And then lastly, I created a field for the patient's birthday. This helps us to know the patient that has the birthday for that day. I'm going to show you how it works when I get to the automation section. And then I created another view. Which helps us to get this view is the gender view. It helps us to see the male and female gender. As we can see here, we have the female and the male. And then I created another view, which helps us view at a glance the attachments and documents for each patient. And then the last view, which is the no consultation. This view helps us to view the patient that hasn't consulted yet. So for the next table, which is the consultation table, these are the different fields I created for this table. As we can see here, remember it's connected to the patient table as it is here. So we have the payment category, services, priority, and complaints, doctor's notes, diagnosis plan, patient history, examinations or findings. We have the nurse's notes, and then we have the amount paid for each of the consultation as it is here. And then this is the tax table linked. This is the tax linked to the tax table. And then this is the finance report linked to the finance report table. So I created a view that says today's consultation. So this view helps us to view the consultation we have for each day. And then lastly, I created another view for the payment category. As you can see here, this is the payment category. We have the surgery, diagnostics, medication, consultation, and all. So let's move to the third table, which is the surgery table. So for the surgery table, these are the details we have. We have the surgery ID, which is the unique ID. And then we have the patient linked to the patient table. We have the assigned doctor, surgery date, rhinoplastic photo to know those patients that needs rhinoplasty. And then we have the surgery table, consent giving, and these are the various fields: post-op summary, complications, surgery monitoring, follow-up dates, amount paid to get the amount paid for each surgery. And then we have the consultations linked to the consultation table, task linked to the task table, and finance report linked to the finance report table. And then I created another view called the surgery pipeline. This helps us to categorize when a patient has requested, or when a patient surgery is requested, in progress, scheduled, or completed. It is the Kanban view. And then we have I created another view for the surgery date. This helps us view at a glance the surgery, the patient, the date for each patient surgery. And then I created a view for the rhinoplastic photo gallery. From here, we can see the attachment attached to each patient. And then lastly, I created a view for today's surgery. This helps us view the surgery that we have for each day. Now let's move to the next table, which is the task table. So this is the task ID. And then this is the patient, link to the patient table, tax title, description. This is the surgery, link to the surgery table. We have the due date. These are the different fields I created, as we can see here: assign staff email, research and audit entry. And then we have the consultation, which is linked to the consultation table. Now let's move to the next table, which is the referral. I have the unique ID. We have the patient link to the patient table, referral date, specialty, reason for referral, and the outcome. Now let's move to the next table, which is the finance report. So for this table, I have the report ID, the patient link to the patient table. We have the services, the payment category. These are looked up. This field are lookup field from the consultation table. We have the visit type, we have the dates, we have the consultation link to the consultation table, the surgery link to the surgery table. And then I use the roll-up field to get the consultation payment. I also use the roll-up field to get the surgery payment. And then we have the expenses. And then I summed up the consultation payment, the surgery payment, and the expenses to get the net income. And then I used the formula fields to get the month and the year. So I created another view for the service category, as we can see here for each patient. And then I created a monthly view to help us get the details per month. As we can see here, this is the details for August, this is details for July, this is details for June. I created another view which is called the payments category, as we can see right here. Now let's move to the last table, which is the patient table. So for the patient table, this is the unique ID. We have the patient name linked to the patient table. We have the email. These are the different fields I created for this table. Now we have the feedback form. So this is the feedback form. So remember, I created a feedback form link on the patient table. So once that link is sent, these are the details the patient will have to fill. So why the name was not included? Because the patient's name, which is right here, which I didn't include in the form, is a linked field, and all linked fields are internal fields, which means the patients cannot see internal fields. And then lastly, we have the patient follow-up table. This is the ID, this is the patient name linked to the patient table. We have the follow-up date and the note. Now let's quickly get into the automations I created. So these are the different automations I created for each of these tables. We have them right here. And then I went ahead to create an automation for the patient's birthday, which says when a record matches condition, send an email. So for example, if the patient's birthday is today, this email is going to be sent to them, wishing them a happy birthday. Now let's go to the next. I created an interface as well. So this is the interface I created for the table. So we have each of these tables have their own interfaces. So this is the interface for the patient table. This is the count. We have a total number of 14 patients, which, as we can see here, this is the bar chart, which helps us differentiate the male from the female. And then I created a list view. As we can see here, we can also add, in this view, we can also add what we want to see. So for example, I want to see the finance report or the patient's birthday or the patient feedback. We can add it right there. So for example, I want to see the patient status. So can we see it has been added? So now let's move to the next table, which is the consultation table. So for the consultation table, I also used a list interface for that, as we can see right here. Now let's move to the next one, which is the surgery table interface. So for this interface, I used the list view, as we can see right here. I used the list view for this table. And then I created another view, which helps us view at a glance the surgery date. I also created another view for the surgery attachment, and I also for the surgery attachment. Now let's move to the next table, which is the tax table. I used the Kanban view for the tax table. As we can see here, I used the Kanban interface. And then I also created a list view, as we can see right here. Let me move this so we can see. And then this is the referrals table. So I use the list view for the referral table. And then lastly, which is the finance reports table. So this is the total number of finance reports we have. And I created a view for using the bar chart to help us view the categories. We have the view the payment category, we have the surgery, diagnostic, medication, consultation. I also created a eye chart as well to help us get the total view of each payment category. And then in this view, I use the bar view to help us get the amount paid. As we can see here, the total net income, which is what we have here. Then I created a list view as well. So this list view is grouped by reports ID, as we can see right here. This view is grouped by the surgeries, as we can see right here, the different surgeries we have. Now let's get into the forms I created for this table. So these are the different forms I created for this table. They all have conditional logic. So this is the form for the patient intake for new patients. This is the consent form. This is the consent form. This is the patient follow-up form. This is the doctor surgery form. The doctor consultation form. We have the nurse consultation form. We have the nurse surgery form. And then here we have the admin form for the admins, all with the linked tables. We have the research audit entry. As we can see here, this is the research audit entry. And then we have the task delegation form. As we can see right here, this is the task delegation form. This is the task delegation form, as we can see right here. Okay, this is the task delegation form. Let me rename this. Okay, so that's that for this project. So if you're a healthcare provider or clinic looking to digitize and automate your workflow like this, I would love to help you. You can reach out to me via DM or my contact. Thank you so much.